this decision is going to kill the program, and when it is needed and when the numbers are trending in the right direction.
I encourage you all to contact the Erie St. Clair Lynn and tell them your opinion. Okay? Yes, please.
Okay, I'm Sue Gibson. I'm the CFO here at Leamington Hospital. And I know a lot has been said about the state of hospital funding. And there's actually a funding reform initiative going on within the province, and this is the third year going. What we've seen with respect to our hospital is our funding has been declining over the past 3 years. It's whittling away little by little, a couple $100,000 here, a couple $100,000 there. So when people say, why can't we just make up the 700 by taking it from another department? We've been faced with this reduced funding over the past 3 years, and we have had to really cut back on our departments and try to take money from one department and apply it to another. But as Terry said, time is running out. As well, with respect to that, we did receive one-time funding for our assess and restore beds. That funding is ending as well. So it's not just as simple as looking at every single department and trying to whittle away a bit here, a bit there. That's what we've been doing for the past 3 years, and time has just run out on us.
Hi, my name is Lisa Grosher. I'm the clinical lead for the family health team, which is right across the street. We are active partners with our hospital, and of course the last thing we want to see is the closure of the hospital. So I encourage you, thank you so much for your passion here today. I encourage you to contact the ministry, the LIN, and anybody else that will hear your voice, because we do not want this hospital closed. We have new doctors to the area. We've been working very closely with the hospital, supporting them in their programs, because we know that when programs close here, it directly affects primary care. And the truth of the matter for the ministry is that across the province, the shift has been to have the right care at the right place at the right time for the right patient. And we know a lot of times the care necessarily is not institutionalized, but isn't primary care. But we still need each other. How that's going to look down the road, I don't know. But I think you have strong voices, and we've faced this in the past, in the 1990s, when we had reconfiguration. The community got together, we did letter writing, because we were slated to close, and we kept it open. And I strongly encourage you to look at how the funding does occur. It doesn't occur by, it is about money, but we really should be looking at our outcomes. If our outcomes are spectacular the way they are here, then that's the way we should be funded, not just by program. And so I encourage you to really let your voices be known. And we will continue in primary care to be active partners with this hospital because we want it to be here in the future, and we have to meet the needs of our patients.
So when people talk about sharing your voice, Zane is actually recording this event. Shane, we will share this. Okay, so that's our obligation to do so, and we will. We also have an obligation relative to the plan that's been approved by the board, but not yet by the ministry or the LIN, to move forward and tell people how we're going to do things. It's a very difficult time for this hospital, very difficult time for this board. Any further questions or comments? Okay, we're back again at 5 o'clock. Hopefully we get more people here. Okay. Thank you for coming, I appreciate it. We'll continue to do these events going forward.